Hey everyone, it's Darren from Avail here. Another question that we get a lot of times is from our buyers. It's really how to sort of compare apples to apples when I'm looking at different practices and what are the benchmarks I should be looking at. Now benchmarks vary from different practice to different practice. There are no two practices that are exactly the same, even though they might be in the same building, they might be producing 1.5 million each. Each of those practices is going to have a different component to it, whether it's maybe a great hygiene program, or maybe they're doing more specialty work, more orthodontics. So each practice is going to have their own idiosyncrasies in terms of even from a staff perspective. One staffing may have a 20-year veteran running the front desk who's brilliant at being able to rebook everyone for their hygiene program. So when you start looking at staff, you're looking at the benchmarks, and you're looking at locations and charts and the different types of procedures in there. You really have to understand a couple of things. It's just making sure that it's right for you. That's the other component. This could be a great hygiene program, it could be great practice, but if you don't do 85 implants a year at this particular practice, it may not be the right location for you until you get your skill set up to that point. Having a great hygiene program means you've got a great patient acceptance in your practice, and you've got a very loyal patient base. So that's certainly one of the main things that we see. But when we look at benchmarks, whether it be rent, or whether it be supplies, whether it be staff wages, all of these vary within a certain range. So understanding what those ranges are for the different sizes and types of practices is also paramount as well. 26% wages for one practice might be overstaffed and might be understaffed for the next practice. So because of the different types of production that goes on in that practice, you may need more or less staff to facilitate that. So understanding the benchmarks and understanding how those benchmarks relate to that practice that you're buying, and the type of work and the type of procedures, and does that match what you're physically able to do as a dentist when you're buying your practice, are probably the biggest component of understanding that. So whether it's 8% rent or 6% rent, I wouldn't get too hung up on that. Obviously, your expenses are what they are, and if you can actually reduce them in some way, shape, or form, as long as your bottom line is solid, you might be spending money on one thing or the other. If that practice matches your modality or the way you practice as a dentist, you're going to be far more successful. So not that I tell people to not worry about what the benchmarks are, you just need to understand how they impact your practice and the practice that you're looking at buying. So be careful when you're looking at practices. No two practices are the same. You want to be able to put them on apples to apples. So as a broker look at a practice, and we come out to a normalized bottom line to make sure that a new dentist coming in can understand what the profitability of that practice is. And then you have to overlay that dentist's ability to be able to practice in that location with that type of patient and that type of practice. So there's so many different layers to look at. You just need to put them all together and have a good team of advisors that'll help you understand, is this the right practice for you? It may be a perfect location, perfect practice, but it might not be the right type of practice for you. So keep that in mind. Keep an eye on the benchmarks. Don't get too hung up on specific numbers as they relate to other practices, because they don't all look and feel and smell the same. So that's it for today. Have a great day.